welcome to the latest episode of the Hunter Baumgardt Sports Podcast. My name is Hunter Baumgardt, your host. You can follow me on Twitter and Instagram at HunterBOnAir. Feel free to like the Facebook page as well, Hunter Baumgardt Sports. Remember, you can watch or listen to the podcast. You can watch on YouTube or listen on SoundCloud. Simply search Hunter Baumgardt Sports Podcast and feel free to subscribe as well. Today, we have a different kind of interview. Usually, we interview like sports media personalities or athletes. Today, we are interviewing an epidemiologist, and it is going to be fascinating. I highly recommend listening to this guy. His name is Dr. Zachary Binney, and he is an epidemiologist, like I said, at the Oxford College of Emory University in Atlanta, and he really focuses on sports. Along with, obviously, epidemiology. So how has COVID-19 affected sports? How will it affect sports going forward? We'll talk vaccines. We'll talk about all the different kinds of things that have to do with us being able to consume sports and also the athletes being able to play it on the field, especially in light of this week's events with the Miami Marlins. So I'm really interested to get to this interview. So with no further ado, here is Dr. Zachary Binney. Joining me this week on the Hunter Baumgardt Sports Podcast is Dr. Zachary Binney. He is an epidemiologist at Oxford College of Emory University in Atlanta. He is a great follow on Twitter. I highly suggest doing so. You can follow him on Twitter at @ZBinney_NFLINJ. Zach, really appreciate the time today. I know you're busy with a bunch of interviews and life probably, so I appreciate it. And
it's been a crazy few days. That's for sure.
Yeah, I bet it has been. So quickly before we get into the specifics of sports and all that is going on with the virus in sports, just give our audience kind of an overview. What is an epidemiologist and why are they so prominent right now as we are kind of, seeking information about COVID-19?
Sure. So like a doctor treats you, you can think of epidemiologists as treating populations. We like to call ourselves the foundational science of public health. So what we do is we look at groups of people, populations, and we figure out what's making them healthy or what's making them sick.
Okay.
And so where our field got its start is with infectious disease, figuring out, for example, how and why cholera epidemics would spread in London. That's kind of the origin story of quote unquote modern epidemiology, if you want to think of it that way. But really, we are quantitative scientists. We use numbers to study health issues in populations. Although I personally think that, and I pitch it to my students this way, that the methods that you learn in epidemiology are applicable far beyond the health field. And for example, I use them regularly in sports analytics and sports statistics.
Yes, exactly. And that's why I wanted to have you on the podcast to talk about kind of the mix that this virus has with sports, obviously, since that's kind of your where you focus. So I want to start kind of with a basic question. We'll kind of get more specific as the podcast goes on. But how do you think our country has done in its response to this virus? How have we as the people kind of, as you look at other, pandemics or how viruses affect, countries, how have we done it? And obviously it's tough sometimes because we compare our country to others that may not have the same population. We see a lot of those comparisons. And also going along with that, are we ready for then a fall sports season where we could have all four major sports going on at the same time? So kind of hand in hand in those questions.
Well, so you have to separate how we did as people, which is more or less as well as we could have done, with how our leaders did, which was almost unimaginably poorly. We, as a nation, on the federal level in particular, had a very late, slow, poor, disorganized, weak response to the virus, and that's why we have far more cases per capita than most other countries on Earth right now, and certainly than most of the other countries in the developed world and in areas like Europe and Asia. They did a much better job of the virus. People were good for a while, and you see all of these stories of like people being irresponsible and holding COVID parties and going to the Lake of the Ozarks or whatever. But what you don't see is the majority of people just going around living their lives in a low risk way. Masking is literally more popular than apple pie. There was a survey done on this. It's true. Look it up.
All right.
So really, as a people, we have done everything we can. But you need a national, strong, coordinated response. And that is, in my opinion, what we have lacked and what has made it harder to bring sports back. I mean, you look at Spain and Italy. I say Germany all the time, but let's look at Spain and Italy.
Mm-hmm.
got hammered at the
Mm-hmm.
start of the pandemic, but have
Yeah.
gotten their outbreaks largely under control. And they were able to finish up the La Liga and Serie A seasons outside of a bubble.
Yeah.
That's what you get when you have a good response to the virus. But our poor response, conversely, has left us in a situation where if we can bring sports back, it's going to be more difficult, more expensive, and more dangerous.
That's a very good point. I'm curious as well, getting into specifically what has been going on with Major League Baseball, because they're the first major sport to come back. They decided not to do it in a bubble, and now they're traveling around, and we've obviously seen the first outbreak with the Marlins. And I'm curious, you talked about yesterday they're throwing all these plans out there, like maybe they're gonna bus to Baltimore from Philly and play there, and doing all these different things. And I saw you tweeted it could be this, that specific plan could be the stupidest possible plan you've ever seen, having to do with keeping people safe. And I'm curious.
I stand by that assessment.
Yeah, and I was going to ask you about that because like if you look at it, is it just because people aren't taking this virus as seriously as they should, and so these plans are keep being made, but really, in your mind as a doctor, you're like, oh my gosh, what are they doing? Like, have you had many of those moments?
So, first of all, I'm not a doctor in the way that most people think of them. I do not
Okay,
have an MD. I do not treat patients. I have a
okay,
PhD.
yep,
So, just want to clarify that. Yes,
yep,
technically, I do go by Dr. Binney, but I can't look at your rash or diagnose your fever or whatever. I don't do that.
sure.
Uh, so, look, I've been a lot more pleased with MLB's response today. We're recording this on Tuesday. That's
Hmm.
been much better than it was on Monday. They've decided to suspend Marlins operations for at least a week. Looks like the Phillies for 4 days.
Hmm.
So, I think that particularly the Marlins are going to have to be suspended longer. I think the Phillies is because more cases of the virus are going to pop up. The Phillies, MLB ran an inadvertent experiment, I guess, if you want to call it inadvertent, but they
Hmm.
definitely ran an experiment to see how well COVID-19 transmits in a baseball game,
Hmm.
in a baseball series.
Yeah.
And we're going to find out in the next few days. But hopefully, the Phillies so far have not had any cases, but the virus can take a few days to rear its head. So if it was transmitted on Sunday, we're not going to find out for until later in the week.
And I'm curious as well, as you look at the Marlins specifically, and they said, they're not going to play for at least a week. Do you think they need to go 2 weeks to make sure all these players, are safe and that the outbreak doesn't continue to spread and to spread to other teams?
Yeah, I think probably that's where it's going to end up.
Okay.
I think that when Major League Baseball was trying to say, well, we'll have to see the results of tests in the next 2 days, that was ridiculous because there was no way that you could declare anybody in that traveling party free of infection in 2 days.
Mm.
Theoretically, if over the next 5 days no other cases came up and everybody who was sick has been strictly quarantined away from the rest of the traveling party, theoretically, I guess by next Sunday, maybe you could say anybody that's left could play again.
Hmm.
But I think that you're going to be having cases coming up over the next few days still on the Marlins, and you're just going to have to let the virus kind of work its way out of the clubhouse. And unfortunately, with this virus, that takes time, and I think it could take up to 2 weeks. So I think that's the expectation that people need to be setting. And if the team can come back earlier safely,
Hmm.
that should be looked at as a bonus, not what you're expecting.
That makes sense. Dr. Zachary Binney joining us on the Hunter Baumgardt Sports Podcast. He is an epidemiologist at Oxford College of Emory University in Atlanta. You can follow him on Twitter at @zbinney_NFL_INJ. Now, I'm curious. We look at some test results, and you just mentioned them. We see such a range in test result time. So like Juan Soto of the Nationals a couple of days ago reportedly had a test that yielded results like immediately, although the MLB didn't trust it. And then of course you hear stories about tests otherwise, just in the public, not necessarily in sports, coming back like for in a couple weeks after the test is administered. Why is there such a difference in time periods for the testing? And do you think maybe it might be because obviously the MLB is coming, their tests come back within looks like about 24 hours because that's what the Phillies did, and that's how they're doing that. But do you think maybe see it as unfair that sports figures are getting those tests, but then the public has to wait for a week or two to maybe get their result?
Well, so first of all, let's talk about a couple of different groups of tests.
Okay.
The most typical kind of gold standard, if you will, diagnostic test is what's called a PCR test. That stands for polymerase chain reaction. That, in many cases, takes several hours to run in a lab. So if you take the sample, either a swab from your nose or a saliva sample, and you run it to a lab and you run it right then, it'll still take a few hours to get back. So that's when you see like the 12 to 24 hour turnaround sometimes for sports leagues. There are also a couple of devices that can run those tests much, much, much faster, like under an hour. Maybe even, under an hour for sure. So sometimes you'll see results from a test like that. I think that was some of the tests that Juan Soto got. So that's how they came back like way faster, even in the 12 to 24 hours. It's a different kind of test. Mm-hmm. There's also been a lot of talk lately about these paper strip tests that function almost like a pregnancy test, but for COVID-19. So those results can come back in a few minutes. So it depends on the type of test. But those are hung up in FDA regulations because there's some concern about, are they as sensitive as the PCR tests? And I won't get too much into the details on that. But when you talk about the PCR tests, that's what most of the public is getting and what most sports figures are getting too. So yeah, in many areas of the country, you're seeing delays of 5 to 7 days or even up to 2 weeks. My own wife took 10 days to get her results back here in Atlanta. So that, when you stack that up against athletes somehow getting results of repeated tests back in a day or two, you do need to ask yourself, are they jumping the line? Is that something that we want to do? And that's a question of morals and values and ethics. I can actually see two sides of it. Okay. What the people who are doing the testing will argue is basically, look, this is a trivial amount of tests in the great scheme of things. MLB wants to use about 275,000 tests over the course of the season. That's about a third of all of the tests that we run in the US on a daily basis. Yeah. 1/3 of one day. So is that really a big deal? Well, maybe not on the group level, but I guess hope that you or your loved one or your coworker at an essential job is not the person whose result gets pushed back a day because there was a lab that had to do a test for a professional athlete, not you.
Yeah.
Okay. So is bringing these leagues back worth it? I mean, how do you balance those two things? It's not a scientific question. It's a moral question and an ethical question, but we need to confront that. We can't just pretend like it's not having any effect. It's having an effect. The question is the effect big enough for us to say the benefits of having sports back, be that social or psychological or economic, is that worth it?
That's a very good point. We're going to get to football here in a couple of minutes, as I know a lot of people probably are curious as to hear your thoughts on that as that starts to ramp up. But one more question on baseball. I've been, the last couple of weeks on the podcast and otherwise, being critical of the schedule that the MLB put together, because they have these weird 2-game series where they go to one park for 2 games and then go to another park. That's kind of what the Yankees and Orioles and Miami actually kind of got caught up in this week, was these 2-game series. So do you think by setting up the schedule this way, is the MLB just setting themselves up for failure this year because they're traveling so much and doing so many weird things? Like maybe they should have just done a full week at certain parks. Are they kind of setting themselves up for failure, do you think?
I'm not sure that I agree with that travel is a big issue. I think that, obviously you don't want to import cases from an area with a lot of cases like Miami to an area that has done a relatively good job, like Philly. That's why when you travel, keeping visiting teams in the hotels, like they're in a bubble, and not letting them interact with the broader community is extremely important. So that you don't have situations like that. But are the Marlins at more risk because they're traveling? I don't think so. I think it's just that the virus is out of control and that you're having players and staff live at home in the communities with their families, and the virus is going to get into the league that way. And the question was, could your testing and your distancing and masking and all of your hygiene protocols, when a case happens, could they keep one case at one case? In the Marlins, they failed spectacularly. And MLB and the Marlins organization need to conduct a swift but thorough epidemiologic investigation to figure out why they had such a big outbreak, what the heck happened, and are there steps they can take in the future to prevent it?
Exactly. And I'm curious, since you talk about, not the traveling specifically maybe being the problem. So do you see the risk as what how would you compare the risk for like a bubble like the NBA and the NHL is doing compared to like an MLB where you're traveling around? Is the risk as great, is the difference in risk as great as maybe we think, or is it just how they react to the positive tests?
Oh, no, the difference in risks, I think, is quite large. I mean,
Okay.
we've seen the National Women's Soccer League, MLS. Well, okay, we've seen the National Women's Soccer League, NBA, and WNBA uh, launch their bubbles basically without a hitch.
Hmm.
And so far, same thing with the NHL in Canada, which they have the advantage of being in Canada, which was a smart move.
Hmm.
The MLS, Major League Soccer, is an interesting example because they had outbreaks on Dallas and Nashville that started before they entered the bubble, but
Mm.
only reared their head after they were in there. But fortunately, stayed isolated to those two teams. So they could just knock those two teams out of the bubble and they could continue on safely. So bubble plans have worked great. Where you get into trouble is when your players and staff are living in their communities with a lot of viral cases around them. So it's not the travel that's the problem with MLB. It's the fact that players are living at home. And so you're like, well, just don't have the players live at home. Well, that's easy for me to say. I'm not being asked to move away from my family for weeks or
Right.
months. Like that's awful. There are no good choices at this stage, unfortunately.
That's true. Dr. Zachary Binney joining us. He is an epidemiologist at Oxford College at Emory University in Atlanta. So I'm curious, going into some football questions for you. Obviously, football is a contact sport.
All
It's
right,
more
football.
contact.
I'm a football guy. Let's do it.
Yeah, let's do it. All right, sounds good. So
All right.
I'm curious. We'll get to the NFL in a second. Do you think for college though, there's very my thought on it has been if you can't have students in classrooms or you can't have fans in the stands, I don't know how you can say that college athletes should be
Yep.
allowed to play. What's your thought on college sports as opposed to professional sports, and specifically football as we head towards that season in the fall?
Yeah. Well, the biggest problem that college football has is the college part of that,
Yeah.
because everybody has to exist on a campus where I think we're probably going to see some large scale outbreaks
Mm.
on college campuses because it's a lot of people living in close proximity with a lot of contacts in class and socially. I don't think football teams are going to be insulated from that. I don't think you can insulate them from that. And I would have very serious ethical questions about, say, the athletes being on campus while everybody else is asked to stay home. I don't see how you can say these are just normal students who are just also happen to be athletes, but they're the only ones on campus. That strikes me as a pretty absurd argument. So we'll have to see. The NCAA, well, schools are kind of waffling on this now. Originally, it was, oh yeah, obviously we won't play if everybody's not on campus, but now you see them kind of backtracking once it looks like a real possibility. The fans is a separate question. We shouldn't have any fans at all until we have a vaccine. We simply don't have the virus under control to the degree that we could create a safe environment. And transitioning to the NFL, by the way, the NFL understands that. Okay, the NFL is forbidding its players from going to professional sporting events with more than 15 fans. And yet they're allowing, because it would be too dangerous. And yet they're allowing their teams to host as many fans in their stadiums as their local authorities will let them, perhaps in some cases up to 20,000. So to me, that's an enormous hypocrisy
Yeah.
that you recognize how dangerous it is, how it could create a potential super spreading event, but you're still going to let your teams do it. So set that aside. The NFL is trying to follow the MLB program, and
Hmm.
we've seen the problem and the outbreak now on the Marlins. So I think you'd be a fool to think that the same thing isn't possible in the NFL. Maybe they'll get lucky. Maybe it won't happen. But between the bigger rosters, the more people involved, and the more contact, I think you would have to assume that COVID-19 is going to have an easier time moving through an NFL locker room than it would an MLB clubhouse. And we've already seen what it can do on the latter front.
Yeah, I was going to ask you. That was going to be my next question. Is basically because it's a contact sport, and specifically in the NFL. Is there any way you see a season where we don't have outbreaks on different teams, and maybe they need to shut down, like the Miami Marlins, or could they because there's only one game a week? Will that help? Do you think?
I don't think that the time difference between games helps all that much because if you have an
Okay.
outbreak, you're probably going to need to shut down for a while. So it would be kind of a miracle. Like I guess
Mm,
I guess if you discovered an outbreak on a Monday and you shut it down for like 5 days, you could be back, but then you haven't practiced. I don't know,
Right.
that feels to me like a really tall order. If you really got to the point where you had to shut down, you would probably end up missing a game, would be my suspicion. And, let's say that you discovered an outbreak on Monday. Well, that means you just played a game against another team on Sunday where you
Mm-hmm.
were on the field, you were on top of each other, spitting on each other. Okay, you got the face shields, but like, you have to think the virus can probably spread. And so then what happens to that team?
Mm-hmm.
They're not going to discover their outbreak
Right.
until Tuesday or Wednesday at best. So then they're going to miss a game. Like, I don't think the spread between games is quite long enough to provide a big benefit.
Yeah, that makes sense. And I think one of my last questions here for you is, a lot of us obviously are missing going to games, and seeing a lot of, part of sports is going and seeing games. And obviously we're going to have to take them in from home for a while. I'm curious, and you mentioned a vaccine. What is your thought overall on a vaccine? I know some people are nervous because if it comes faster, they're going to say, well, they haven't put it through the trials, so I'm not comfortable. What's kind of your thought as an epidemiologist about a vaccine, and what we can do once there is one, and going back into these, concerts and fans and stands again?
Yeah. So a couple of different questions there in your
Mm-hmm.
question. Number one is about fans. Look, every step we take back towards normality has a risk and a benefit associated with it. Our job is to find things where the benefit outweighs the risk. Gathering in large numbers for sporting events or concerts, or even in bars, or, I hate to say it, and I really do sympathize with this, and I understand the gravity of what I'm saying, indoor churches, is a really, really, we know that those are dangerous atmospheres for the spread of the virus. So we want to avoid those high risk activities, particularly when the benefit, like at a sporting event, is just not worth the added risk, not just for you, but for your community, because your personal choices are not just your personal choices. I hear
Mm-hmm.
all the time, well, hey, Zach, if you're so scared, just don't go to the game. Well, okay, but you know what I can't do? I can't guarantee that when I go to the grocery store, I'm not there with somebody who went to the game. And maybe they're wearing a mask, or maybe they're not. Okay. So they can spread it to their families, they can spread it to their community. We need to not offer the opportunity for super spreader events right now. That's just, I am not telling people to stay in their homes. I understand that that's untenable. It's not something that we should be asking at this point.
Mm-hmm.
But we need to have a rational conversation about low risk, medium risk, and high risk activities. And there needs to be bend from both sides. Public health officials have been more than willing to talk about low and medium risk, things that we can reopen and that we recommend people do. We're not asking people to go back to the March lockdown unless things get really desperate. But they're not there yet. But we also need bend from the other side. You can't just do everything you used to do.
Right.
And so when we say that there's something you really can't do, I would beg people to listen to us and take that seriously. As far as a vaccine, I
Mm-hmm.
have faith that when it comes and when it's approved by the FDA here in the United States, that it will be safe and that it will be effective. And I will be getting it as soon as I possibly can.
Mm-hmm.
I think the earliest we can reasonably expect a vaccine is early 2021.
Mm-hmm.
I don't think, it's not a guarantee that we're going to get it then by any means. It could be longer, but it's a possibility.
Mm-hmm.
But even if we do, it's important for people to understand that not everybody is going to get vaccinated immediately.
Yeah.
It's going to take time, probably months, to
Mm-hmm.
do that. So even if we, quote unquote, have a vaccine in January, we may not have herd immunity from the vaccine until June, July, or longer.
Mm-hmm. Is that like the only way? It sounds grim, but is that like the only way out of this that you can see? Or is this just, is this going to continue to be like this until there's a vaccine? Like, is that just kind of the?
Unless we decide we want to kill a whole lot of people, then yes, I foresee
Yeah.
that as the the most likely exit. It's not the only one. Maybe we could find a very effective therapeutic, something to use to treat people when they get sick, but we haven't quite found that yet. So I would have to say that my number one hope is a vaccine for sure.
Sounds good. Well, he's Dr. Zachary Binney. He is an epidemiologist at Oxford College of Emory University in Atlanta. Zach, I really appreciate the time. Really interesting points, and I am sure that the audience will enjoy it and really think about some of the points you made about sports and different things, and as we move forward. So I really appreciate it.
Sure thing, my pleasure. To you and all your listeners, take care, stay safe, wear a mask, avoid large gatherings, especially indoors.
Exactly. Sounds good. Thanks so much. That is Dr. Zachary Binney, an epidemiologist at Oxford College of Emory University in Atlanta. You can follow him on Twitter, and I highly suggest doing so at zbinney_NFL_INJ. And like I said, I highly suggest you follow him because he constantly tweets throughout the day about what is going on in sports, what is going on with the virus in sports specifically, and how he would do things and how MLB is doing things, how the NFL is doing things, etc. So all the points he just made in the podcast, he continues to make on Twitter and will continue to do so, I know. So definitely follow him on Twitter. But either way, I hope you enjoyed that interview as much as I did. I thought it was fascinating. I thought there was a lot of great points in there. And just specifically how COVID-19 is affecting sports, how it will continue to affect sports, how football might be affected. He said, obviously traveling and doing not the bubble, it's interesting. Half the major sports, if you take the four major sports, NHL, NBA, MLB, and NFL, two of them have went bubble, two of them have went not bubble. So far, the bubble has worked basically seamless for the NBA and the NHL. The NHL, of course, not fully going yet, and the NBA just about to. But either way, if you look at the MLB, they've had some positive cases. Now, really, it's hopefully going to be contained here, but we shall see. In the NFL, we don't know what's going to happen yet, but that is another risk if you're traveling around. But also, like he said, avoid large gatherings, avoid bars, etc. It is just we need to keep the numbers down, keep people safe. And hopefully, like you said, that vaccine can come in early 2021. And I hope you just enjoyed the interview and kind of the perspective of an epidemiologist on all of this. And he explained, obviously, what an epidemiologist does, what he does, etc. So hope you enjoyed it. I found him first when he was on the radio network that I host for, Sports Map Radio Network. And then I was like, you know what? I should really get him on the podcast because I thought you'd be interested in what he had to say about sports and about the virus. He obviously knows what he's talking about. He's done a ton of interviews this week, including CBS this morning, and was on different radio networks as well and radio stations across the country. So fantastic interview. Hope you really enjoyed it. And again, you can watch it or listen to it. You can watch on YouTube, listen on SoundCloud. Simply search Hunter Baumgardt Sports Podcast. You can follow me on Twitter and Instagram at HunterBOnAir. Feel free to like the Facebook page as well, Hunter Baumgardt Sports. Stay healthy, stay safe, and enjoy. The MLB is back right now, and as much as we want to talk about the virus and stuff, I think it is important to enjoy, as long as they're staying safe, enjoy baseball, because we have finally had it back. And I know it's kind of been a surreal feeling, honestly, to be able to watch the Brewers at night. It's unreal. It is honestly a surreal feeling. I mean, this whole year's kind of felt like a dream, but it's continuing to feel like a dream because we didn't know when this would happen. So I think definitely enjoy it, as well as the Bucks resume on Friday against the Celtics, and we'll continue to talk about sports as we move on. But I wanted to get an epidemiologist on to talk about the virus in sports, because that's exactly what is on all of our minds. So hope you enjoyed it. I'll talk to you next week. And as always, stay positive.